we're just going to do a quick demonstration of vacuum suction massage. So this is the UltraVac machine. These glass electrodes are ventouses, so generally on the neck and the outskirts of the face we would use the large ventouse. So the first thing that you need to do is test the suction on yourself. So you turn on your machine, which is run by a motor, so there's no electrical current. You see there's a little hair hole, so you pop your finger on the hole and then pop it onto your skin. The maximum lift into the skin is 20%, so I'm just going to turn that down a little bit. And then you sanitize that before you use it on your client. So the next thing you're going to do is just have a quick check for contraindications and then apply your oil onto your client's skin. So vacuum massage is like a continuation of your manual massage, so as it increases lymphatic flow to the lymph nodes. So just apply it, and you need to go make sure right down on the neck, and you need to go right down the décolleté as well. So just make sure you bring it right out and make sure you go up right behind the ear so you get nice flow. So once you're ready to go, you turn your machine on. So what you're going to start then is down here on the décolleté area in the chest. So we're going to be draining in to the thoracic duct. So you're going to keep contact with the skin, a slight push and glide method, and we're overlapping by half a cup each time. So you want to get that sound like the pop and exaggerate the release with the finger. So check for erythema. You will definitely get erythema on the skin due to the vasodilation. So then we're just going to go up onto the neck area. There's no lymph nodes, okay? The only lymph nodes in the neck would be here on the submandibular or here at the masseter at the back of the ear. So what you can do is get your client to hyperextend back, and you can go right up just underneath the jawline. Or if you find that one tricky with your wrist, what you can do is just drain out to the sides. And there's no lymph node there at the side, so what you need to do is bring that lymph all the way up to the mastoid node at the back, all the way at the back. So make sure if you need to turn your client's head, turn your client's head. Then you do the exact same on this side. Keeping an eye on erythema. And then make sure you catch all of that drained lymph up to behind the ear, which is the mastoid. Then what we're going to do is go along the jawline to the front of the ear, and the lymph node at the front of the ear is the parotid. Then what we can do, if they don't have a lot of sensitivity, you can use this lymph node across the cheeks. And again, we're going to the parotid node. Just be wary of the eye area as well. So what we're going to do now is we're going to change to a smaller ventouse, and what we generally use would use the lymphatic drainage ventouse here. So again, because it's a smaller aperture, we're going to have to increase the suction with this one. So again, you always test on yourself first, and once you've done that, then you clean your electrode, okay, or your ventouse, and then we're going to start working on the T-zone. So what we're going to do is we're going to go from just below the lip to the point on the chin. So it's a gliding method we're using. And exaggerate the release of the finger. The next node we're going to is the buccal node, and they're like a bunch of grapes just here at the apple of the cheek. So get right in there to the nose and release. Just mind the eye area as well to avoid any bruising, and exaggerate that release. So next thing here, we're going to drain the sinuses, and remember you have to drain to the nearest lymph node. The nearest lymph node here would be the front of the ear, which is the parotid. So what we're going to do first is just drain up, and then you need to turn your wrist and get right down to the parotid node. And same on the other side. So once we've done the whole face, you can repeat the whole routine again, all right? But what you want to do, if you want to do more of a deep cleansing work, you would go and you can use either of these two ventouses. This is the pore cleansing ventouse, whereas this is the comedone ventouse. The only difference with the comedone ventouse, there is no hole on it, so I'll just show you how to use that ventouse. So again, you check it. I would use this on the highest setting you possibly can. Okay, give it a quick clean before you use it on your client. So what you're going to do, because there's no hole, you'll have to break the suction with your finger. So you prop it on the comedone and then you slide to release. So never just pull it straight off, or it could result in a bruise. and in theory it should suck out the comedones. So if you do it maybe desincrustation first or steaming, okay, it would work really well. What you can do then, if you want to concentrate on the oily areas, you could use the pore cleansing ventouse, drain down to the node. You could drain the forehead if necessary, or if your client is more concerned with aging and temporarily wants to plump up fine lines, you could use the pulsating method on maybe the likes of the crow's feet. Again, it's only a temporary method, and you can do it then on both sides. And then I always finish off the treatment then with a massage to encourage the flow of lymph to the lymph nodes. So always kind of do your draining towards the lymph nodes, just to encourage the flow of lymph. So just to recap on the lymph nodes, you have your buccal, parotid, your mastoid, and your main lymphatic duct is the